Hi there, I'm Dr. Shreyash from Gold Gym Fitness Institute. In this video, we will be learning about the human skeleton step by step. So grab a book and a pen before we begin. This picture shows the human skeleton from front and from back. The front side of the skeleton is called as the anterior side, and the back side of the skeleton is called as the posterior side. You can pause the video and note down the definition of the words anterior and posterior. If you observe this picture, there are two colors given to the skeleton. The center of the skeleton is given blue color, and the hands and the legs of the skeleton are given yellow color. This means the human skeleton is divided in two parts. The center of the skeleton, which is shown in blue color, is called as the axial skeleton, and the hands and the legs, which are also called as the limbs, shown in yellow color, is the appendicular skeleton. Now let us see the axial skeleton in detail. The axial skeleton is divided in three parts. The skull, which is also called as the head. The rib cage, which is also called as thoracic cage or thorax. And the vertebral column, which is also called as the spine or vertebrae. Now let us see the bones of the skull in detail. The human skull consists of two parts. These bones shown in blue color are the cranial bones, which are together called as the cranium. It consists of 8 bones which are called as cranial bones. These cranial bones surround and protect the brain. And these bones shown in blue color are facial bones. There are 14 facial bones which form the underlying structure of face and support of the teeth. With the exception of the mandible, the bones of the skull articulate with each other, that is, they stick to each other through joints known as sutures or suture joints. Throughout the skull, there are holes or openings for the passage of blood vessels like arteries and veins, and also nerves. These openings are called as foramens. Now let us see the names of 8 cranial bones. This is the occipital bone, located at the posterior side of skull. These are the left and the right parietal bones. These are the left and the right temporal bones. This is the frontal bone. And if you open the skull and see, there is a butterfly-shaped bone called as the sphenoid bone. And the last one is ethmoid bone. This ethmoid bone makes a portion of the cranial floor and also the roof of nasal cavity. Now let us see the 14 facial bones. These are the left and the right nasal bones. These are the left and the right zygomatic bones, which are also called as the cheekbones. These are the left and the right maxilla bones. And this is the mandible, which is also called as the jaw bone. To further see the facial bones, we will have to open the skull and see inside. These are the two L-shaped palatine bones. And these are the small, thin lacrimal bones. This is the claw-shaped vomer bone. And the last is the left and the right inferior nasal concha bones. To make things easy to understand, this is another 3D presentation of the cranial bones and facial bones. Now let us see the anatomy of vertebral column, which is also called as the spine. The human spine is made up of 24 spinal bones called vertebrae. These vertebrae are stacked on each other to make the entire spine. The spinal column gives the body its main upright support. From the side, the spine forms three curvatures. The neck region, called as the cervical spine, curves slightly forwards, that is anteriorly. The mid-back or thoracic spine curves backwards, that is posteriorly. This outwards curve in thoracic spine is called as kyphotic curve. The lower back, also called as the lumbar spine, curves slightly forwards. This forward curve of the spine is called as lordotic curve. Let us see the cervical vertebrae. The cervical vertebrae are the smallest vertebrae in the spinal column. There are 7 cervical vertebrae. The first cervical vertebrae, C1, which is also called as the atlas, supports the skull which sits directly above it. And it only has an anterior arc and a posterior arc with no body or spinal process. The second cervical vertebrae, which is also called as axis, has its odontoid process or dens. This process helps the atlas and the skull to move on it. The seventh cervical vertebrae, which is also called as the vertebra prominens, is the most prominent vertebra because its long spinous process protrudes from under the skin and is visible to the naked eyes. Now let us see the thoracic spine, shown in green color in this image. The thoracic spine is located in the middle section of the vertebral column, inferior to the cervical vertebrae and superior to the lumbar vertebrae. There are 12 thoracic vertebrae denoted as T1 to T12. Their size is larger than the cervical vertebrae but smaller than the lumbar vertebrae. Each of the 12 thoracic vertebrae have a pair of ribs attached to them. This is unique because no other type of vertebrae have ribs attached to them. Now let us see the lumbar spine. The lumbar spine is located at the bottom section of the vertebral column, inferior to the rib cage and superior to the pelvis and sacrum. As compared to the other vertebrae, the lumbar vertebrae are largely responsible for carrying the weight of upper body, and hence they are the largest vertebrae in size. There are 5 lumbar vertebrae found in human adults, denoted as L1 to L5. Now let us see the sacrum and the coccyx. To study the sacrum and coccyx, we will be seeing these two images. You can see on the left side is the anterior side of sacrum, and also here the coccyx. And on the right side is the posterior view of sacrum and coccyx. You can see clearly that the sacrum is a triangular shaped bone made up of 5 infused bones which fuse together at the age of 18 to 30 years. These bones are named as S1 to S5, and coccyx is made up of 4 small bones which are fused together. So the total number of bones in vertebral column are 33. 7 cervical vertebrae C1 to C7, 12 thoracic vertebrae T1 to T12, 5 lumbar vertebrae L1 to L5, 5 sacral vertebrae which are fused S1 to S5, and 4 coccygeal vertebrae. And the total is 33 vertebrae. So guys, we studied the skull which has 22 bones, the thoracic cage which has 25 bones, and the vertebral column or the spine which has 33 bones, which means the axial skeleton has total 80 bones. Now let us see the appendicular skeleton step by step. The appendicular skeleton consists of the upper limbs and the lower limbs. Let us study the bones of upper limbs first. The skeleton of the upper limbs is divided in 4 segments. The shoulder, made up of the scapula and the clavicle. The arm, made up of the bone humerus. The forearm, which includes the radius and ulna, and the hands, made up of the carpals, metacarpals, and phalanges. The clavicle is commonly called as the collarbone. This is the sternal end of clavicle bone because it connects to the bone sternum, which we have studied before. And this is the acromial end of clavicle bone, which connects to the acromion process of scapula. We will study the scapula bone later. This is a more detailed view of clavicle, showing the superior and inferior view of the clavicle bone. The second bone in upper limb is scapula. It is a flat triangular shaped bone located at the posterior side of the thorax. If you observe, at the posterior surface of scapula, there is a prominent ridge called as the spine of the scapula. And at the end of this ridge, there is a process called as acromion process. Like I said before, acromion process attaches to the clavicle. Just to the anterior of acromion process, there is coracoid process, which helps to stabilize the shoulder joint. Above the spine of scapula, there is a flat surface called as the supraspinatus fossa. Below the spine of scapula, there is another flat surface called as the infraspinous fossa. And here, on the anterior surface of scapula, there is another flat surface called as the subscapular fossa. All of these fossas are attachment sites for the muscles of rotator cuff. This is the glenoid fossa, where the head of humerus bone attaches and makes the shoulder joint. The next bone is humerus, which makes up the arm section of the upper limb. We have two views of humerus here, the anterior view and the posterior view. This central portion is the shaft of the humerus, and the superior end of the humerus is called as the head of the humerus. And at the base of the humerus, there are two bony structures called as the medial and the lateral epicondyles. And just below the epicondyles is the condyle of humerus, which is the point of articulation, means the point of elbow joint formation between humerus, radius and ulna bones. There are two bones that make up the forearms of the upper limbs, the radius and the ulna. The radius is located to the lateral portion of forearm, which means that portion of forearm which is to the thumb side. This is a more clear view of radius, and if you notice, the radius is shorter as compared to ulna. The structures on the radius are fairly simple. At the superior end of radius is the head of radius, which articulates with the condyles of humerus as we saw before. To the inferior end of radius, there is a notch called as the ulnar notch, which attaches to the ulna. And laterally, that is to the side, there is a conical projection called as styloid process. The next bone is ulna, which is much larger than the radius. It is easily distinguishable by the large olecranon and coronoid processes at the superior end, which form the large trochlear notch shown here. On the lateral side of coronoid process is a small depression called the radial notch. This radial notch rubs against the head of radius, and hence it is called as radial notch. At the distal end or inferior end, there are only two structures, the head of the ulna here and the conical styloid process. Please note, the styloid process of radius is located laterally and the styloid process of ulna is located medially. Distal to the forearm is the wrist and hand. The wrist is made up of 8 small individual bones called carpals. All these 8 bones allow the fluid mobility and the wide range of motion in the wrist. A simple way to remember the names of these 8 bones is some lawyers take profits that they can't have. This will help you to remember the names and the locations of these 8 carpal bones of the wrist. The names are scaphoid, lunate, trichitrum, pisiform, trapezium, trapezoid, capitate and hamate. Let's see their actual locations. We have the scaphoid, lunate, trichitrum, pisiform, and if you notice, these 4 articulate with the radius and ulna. And then we have the trapezium, trapezoid, capitate and hamate, and these 4 articulate with the bones of palm. And this is an easy way to remember the names of 8 bones of the wrist. Trapezium is found at the base of the thumb, trapezoid at the base of the index finger, capitate at the base of middle finger, and hamate at the base of ring and pinky finger. Now let us see the bones of hands. The bones that form the palm of the hand and articulate with carpals are called as metacarpals. There are 5 metacarpals which don't have special names but instead are given numbers. Starting with the metacarpal which attaches to the thumb, called as the first metacarpal. They are named as 1 to 5 and the 5th metacarpal is of the little finger. All the remaining bones distal to the metacarpals are the bones of fingers and are called as phalanges. But because there are multiple phalanges in each finger, we have to further define them as proximal, middle and distal phalanges. Each finger has a proximal phalanx. Only the 2nd, 3rd, 4th and 5th fingers have a middle phalanx. And again, all of them have a distal phalanx, which means only the thumb does not have middle phalanx. Now let us study the bones of lower limbs. Let us see all their names first. This is the hip bone. This is femur, which is the longest and the strongest bone of human body. This is patella, which is also called as the kneecap. And this bone is called as tibia, which is also called as shin bone. And the bone next to it, a thin bone, is fibula. The ankle joint has 7 different bones. These 7 bones together are called as tarsals. After tarsals, there are 5 metatarsals which are located here in this region. And then comes the 14 phalanges, just like the upper limbs. Now let us see each section of the lower limbs one by one. Let us see the hip bone. The hip bone is a fusion of 3 bones, the ilium, the ischium and the pubis. And this is the sacrum, as we have seen before. This joint where the pubis of left and right hip bones join together is the pubic joint. This joint where the sacrum and the ilium join together is the sacroiliac joint. And this depression here is called as the acetabulum. Femur is the longest and strongest bone of human body. This is the shaft of femur. As you can see, it is one of the longest shafts in your body. This is the neck of femur. And this, shown in blue, is the head of femur. This is the distal end of femur. This portion is the medial condyle of femur, and this portion is the lateral condyle of femur. The articular surface of medial condyle and lateral condyle articulate with the articular surface of tibia to form the knee joint. Now let us see the tibia and fibula. This is the proximal region and this is the distal region. So starting with the proximal tibia, this is the tibial plateau. This articulates with the condyles of femur, which then form the knee joint. Just like femur, even tibia has the medial condyle and the lateral condyle. Now going on to the fibula, we have the head of fibula and the apex of fibula, which is also known as styloid process. As you go down, this is the shaft of tibia. And on the distal region, we have the medial malleolus, which is located on tibia, and the lateral malleolus, which is located on the fibula. This region here forms the ankle joint. The distal end of tibia and fibula articulate with the tarsals of the foot, which we will see next. Now let us see the bones of foot. The bones of foot consists of tarsals, metatarsals, and phalanges. There are 7 tarsal bones. This bone here, which articulates with the tibia and fibula, is called as the talus bone. And this big bone here is the calcaneus, which is commonly called as the heel bone. We actually stand on this bone. These 3 bones here are cuneiform bones, which are named as medial, intermediate, and lateral cuneiform bones. These cuneiform bones articulate with the first, second, and third metatarsal. And this bone here is the cuboid bone, which articulates with the 4th and 5th metatarsal. And this is the navicular bone, which attaches with other tarsals and not with metatarsals or tibia fibula. Distal to the 7 tarsals, you have the 5 metatarsals. And there is a base, a shaft, and a head to each metatarsal. And more distally, you have the 14 phalanges. And just like we saw with the fingers of hands, we have distal, intermediate, and proximal phalanges in the foot as well, except for the big toe, which just has the proximal and the distal phalanx. Now let us see the main joints and connective tissues. The top of the foot is referred to as the dorsal surface. The sole of the foot is the plantar surface. The outside of the foot is referred to as the lateral side. The bony bump on the lateral side is called as the lateral malleolus. The inside of the ankle is referred to as the medial side. The bony bump on the medial side is called as the medial malleolus. The ankle joint is formed by the connection of 3 bones: the talus, the tibia, and the fibula. The top of the talus fits inside a socket made by the lower ends of tibia and fibula. The bottom of the talus sits on the calcaneus, which forms the heel bone. The talus helps your ankle joint to move like a hinge. Moving up is called as dorsiflexion, and moving down is called as plantar flexion. Inside the ankle joint, the bones are covered with the articular cartilage. The articular cartilage is 1/4 to an inch thick in most of the joints of the body which carry your body weight. The articular cartilage is soft enough for shock absorption and tough enough to last for a lifetime. Ligaments and tendons are soft tissues which attach bone to bone and muscles to bone. The ligaments attach bone to other bones, and tendons attach muscles to bones. Both of these structures are made up of fibrous collagen material. The collagen fibers are bundled together to form a rope-like structure. Ligaments and tendons come in many different sizes and shapes. The thickness of a ligament or a tendon determines its strength. Ligaments on both the sides of ankle joint stabilize the ankle joint. 3 ligaments make up the lateral ligament complex. These include the anterior talofibular ligament, the calcaneofibular ligament, and the posterior talofibular ligament. A group of ligaments called as the deltoid ligaments support the medial side of the ankle joint. Ligaments are also important in connecting the distal end of tibia and fibula where it forms the ankle mortise. This connection and the collection of ligaments that support this are called as ankle syndesmosis. 3 ligaments form the syndesmosis. The anterior inferior tibiofibular ligament connects the tibia and fibula to the front of the ankle joint. The posterior tibiofibular ligament connects the tibia and fibula posteriorly. These ligaments include the posterior inferior tibiofibular ligament and the transverse ligament. The interosseous ligament is in between the tibia and fibula. Interosseous means between bones. This interosseous ligament is a sheath of ligament which connects the tibia and fibula right from the knee to the ankle joint. The ligaments that surround the ankle joint help form the joint capsule. The joint capsule is a watertight sac which is formed around all the joints. It is made up of the ligaments around the joint and also the soft tissues between the joints which fill in the gap of the joints. Several muscles and tendons are important for ankle joint functions. The Achilles tendon is the most important tendon for walking, running, and jumping. It attaches the 2 calf muscles, the gastrocnemius and soleus, to the calcaneum and allows us to raise our foot. This posterior tibial tendon allows us to turn the foot inwards. The anterior tibialis tendon attaches the anterior tibialis muscle to the foot and allows us to raise the foot. The 2 peroneal tendons run behind the lateral malleolus and help us turn the foot down and out. These 2 muscles and their tendons are called as Peroneus longus and Peroneus brevis. Peroneus brevis is the shorter muscle and it attaches at the base of the 5th metatarsal. Peroneus longus runs further before attaching under the foot. So now we have a basic understanding of the important structures of the ankle. This will help you understand the injuries and conditions affecting the ankle joint and also the exercise related precautions that you must take with your clients. As far as exercises are concerned, the knee joint is one of the most important joints. To better understand how knee problems occur, let us study the anatomy of knee joint. First, let us understand some anatomical terminologies. This will help you to understand the structures later. This will not only help you to understand the knee joint, but it will also help you to understand other anatomical structures and other joints of your body. Medial means closer to the midline. So the medial side of the knee is the side which is closer to the other knee. The lateral side of the knee is the side which is away from the other knee. Structures on the medial side have medial in their name. For example, the medial meniscus. The term anterior means to the front of your body and the term posterior means to the back of your body. So the anterior cruciate ligament is to the front of posterior cruciate ligament. The knee joint is made up of femur and tibia, and patella or the kneecap sits in front of the knee. The knee joint is a synovial type of joint which has joint capsule which contains the synovial fluid inside it. The end of the femur connects to the top of the tibia to form the knee joint. 2 round knobs called as the femoral condyles are found at the base of the femur. These femoral condyles rest on the top surface of tibia, which is called as tibial plateau. To the lateral side is the lateral tibial plateau, and to the medial side is the medial tibial plateau. The patella glides into a groove made by two femoral condyles called as patellofemoral groove. The small bone fibula is not really a part of knee joint. It just connects to the top of tibia where it moves very little. Articular cartilage is a material that covers ends of the bones of any joint. It is 1/4 to an inch thick in most of the large joints. It is white and shiny with a rubbery consistency. Articular cartilage is a slippery surface which allows the bones to slide against each other without friction. The function of articular cartilage is to absorb shock and to provide a slippery surface for ease of movement. In your body, wherever two bones are coming in contact with each other and forming a joint, there articulating cartilage is present. In the knee, the articular surface is present at the base of the femur, the top of the tibia, and the back of the patella. Ligaments are a band-like structure which connect bone to bone. Two important ligaments are found to either side of knee joint. They are the medial collateral ligament or MCL and lateral collateral ligament or LCL. Inside the knee joint, there are two important ligaments attaching the femur and the tibia. The anterior cruciate ligament or ACL to the front and posterior cruciate ligament or PCL to the back. The MCL and LCL prevent the knee from moving side to side excessively. The ACL and PCL control the front and back movement of the knee joint. The ACL prevents the tibia to slide too far forward. The PCL prevents the tibia to slide too far backwards. ACL and PCL prevent the back and forth excessive motion of the knee joint. All these four ligaments play a crucial role in the stability of knee joint. Two special type of ligaments called as menisci sit between the femur and tibia. They are sometimes even called as the cartilages of the knee. But they are starkly different from the articular cartilages. The two menisci of the knee are important for two reasons. One, they spread the impact on the knee joint equally on the cartilages. And two, they increase the stability of the knee joint. Imagine the knee as a ball resting on a flat plate. The ball is the condyle of femur and the plate is the tibial plateau, and the menisci fill up the space between the ball and the plate. The menisci act as a cascade to distribute the weight equally on the tibial plateau. Without the menisci, the weight will be concentrated at just one single point on the tibial plateau. But with the menisci, the weight is spread equally on the tibial plateau. The distribution of impact or weight by menisci is important as it protects the cartilages of both the bones. If the menisci are absent, the weight will be concentrated on a single point on tibial plateau, resulting in degeneration of the cartilages of both the bones. The menisci also increases the stability of the knee. The menisci act just like a wedge at the bottom of a car tire. The menisci are thicker at around the outside portion, and this allows the femur to roll freely over the tibia. The menisci convert the tibial surface into a shallow socket. This transfers the weight of upper body efficiently onto the knee joint. Injury to a menisci during exercise can drastically affect the performance of knee joint further. Also, the ligaments play a crucial role in the stability of knee joint. Unlike other bones in the body, the knee joint lacks a bony configuration. Remember, ligaments connect bones to bone. Without these ligaments, the knee joint can literally become loose. Tendons are similar to ligaments, except that tendons attach muscles to bones. The quadriceps tendon attaches the large quadriceps muscles of the thighs to the patella. This tendon, after crossing the patella, blends into the patellar tendon. The patellar tendon connects the patella to the tibia. The hamstring muscles at the back of the thigh also have tendons which attach at different locations of knee joint. These tendons are sometimes used as grafts to replace injured tendons in the knee joint. The extensor mechanism of knee joint allows us to walk. The extensor mechanism of the knee is made up of the patella, the patellar tendon, the quadriceps tendon and the quadriceps muscles in the front of the knee. The 4 quadriceps muscles of the thigh attach to the quadriceps tendon. So when these 4 quadriceps muscles contract, they straighten your knee joint. The way in which the patella fits into the patellofemoral groove in front of the knee joint affects the mobility of the knee joint. The patella works like a fulcrum, increasing the force exerted by the quadriceps muscles while extension of your knee. The hamstring muscles are large muscles at the back of the thigh. When these muscles contract, the knee bends. The knee has a somewhat unstable design, but it still supports the entire weight of body while walking, running or jogging. And that is the reason why knee problems are so common in all the age groups. Understanding the anatomy of knee will help you to understand knee injuries in relation to exercise. Now let us study the anatomy of hip joint. The hip is a true ball and socket joint. And this arrangement helps the hip joint to be useful in lot of activities like walking, running and stair climbing. Now let us understand the anatomy of hip joint in layers. This will help you understand how the hip joint works and also how the hip joint can be injured. You will also understand how a hip joint injury can be challenging. The deepest layer of the hip includes the bones and the joints. The next layer is made up of the ligaments of the joint capsule. And finally, the hip joint is covered with important tendons and the muscles of the hip joint. The bones that form the hip joint are the femur or the thigh bone and the pelvis or the hip bone. The top end of the femur is shaped like a ball, which is called as the femoral head. The femoral head fits into the socket which is present to the side of the pelvis. This socket is called as the acetabulum. The femoral head is attached to the rest of the bone by a small piece of bone called as the femoral neck. Next to the femoral head is a large bump. This bump is called as greater trochanter and you can feel it to the side of your hip. Large and important muscles connect to the greater trochanter. Articular cartilage is a material that covers the ends of the bones at any joint. It is 1/4 to an inch thick, especially at weight-bearing joints like the hip joint. Articular cartilage is white and shiny and has a rubbery consistency. It is slippery and hence it allows free motion between the bones of a joint. The function of articular cartilage is to absorb shock and to make motion between the bones frictionless. In your body, wherever there are 2 bones coming together to form a joint, articular cartilage will be present. In the hip joint, the articular cartilage covers the head of femur and the socket of pelvis. The cartilage is found to be thick in the upper and back part of the socket. This is exactly where the force occurs while walking and running. Ligaments are soft tissue structures that connect bone to bone. There are several important ligaments in and around the hip joint. Even the joint capsule is made by the ligaments which connect the top of the femur to the acetabulum. This joint capsule is a watertight sac which surrounds the hip joint. These ligaments are the main source of stability for the hip joint. They stabilize the hip joint by holding the femoral head into the socket. There is a small ligament present at the tip of the femoral head. It is called as ligamentum teres, and it does not play a role in stability of hip joint. But through the ligamentum teres, the femoral head receives small blood supply through arteries. Tendons are soft tissue structures that connect muscle to bone. A long tendon band called as the iliotibial band runs alongside from the hip joint to the knee joint. This iliotibial band is a connection point of large hip muscles. A tight iliotibial band can cause hip or knee problems. A special type of ligament is present inside the hip joint called as the labrum. The labrum is attached almost completely at the edges of acetabulum. This makes the socket more deeper for the attachment of head of femur. This labrum can be injured if you perform incorrect forms for an extended period of time. The hip is surrounded by large, thick muscles. 3 gluteus muscles, the gluteus medius, the gluteus minimus, and the gluteus maximus, make up the muscles at the back of your hip joint. These muscles extend or pull the thigh backwards and abduct or pull the thigh away from the other leg. The gluteal muscles also keep the pelvis in level while you are walking or running. The inner thigh is formed by the adductor muscles. The main action of the adductors is to pull the leg inwards towards the other leg. The muscles that flex the hip joint or pull the thigh forwards are present in front of the hip joint. These includes the iliopsoas and the rectus femoris muscles. The iliopsoas is a deep muscle that begins by attaching to the lower spine. It travels out of the pelvis to connect to the inside edge of the upper femur. The rectus femoris is one of the quadriceps muscles, which are a large group of muscles to the front of the thigh. There is also a small, thin, strap-like muscle called as the sartorius muscle. It runs from the hip joint, across the knee, and connects to the top of the tibia. Several small muscles travel from inside of the pelvis to the back of the pelvis, crossing the hip joint and attaching to the back of the femur. These muscles help to stabilize the hip joint and rotate the hip joint outwards. Together as a group, these muscles are called as the external rotators of the hip joint. Finally, the hamstring muscles run down the back of the thigh. These muscles originate at the bottom of the pelvis. If you notice, the hamstring muscle crosses the back of the hip joint on their way to the knee. They help to extend the hip joint backwards. Wherever there are chances of friction between the muscles, tendons, and bones, there is a structure present called as bursa. The bursa is a vacuum space filled with fluid to reduce friction and create buoyancy. It is because of the bursa that the shoulder joint and the hip joint are so mobile and functional. There is a bursa which causes sometimes problem in the hip joint. This bursa is present between the greater trochanter and the muscles which cross the greater trochanter. This bursa, called as the greater trochanteric bursa, can get irritated and inflamed. This condition is called as trochanteric bursitis. Another bursa is present between the iliopsoas muscle and the hip bone, where the iliopsoas tendon passes the hip joint. When this bursa becomes inflamed, the condition is called as iliopsoas bursitis. A third bursa covers the ischial tuberosity, the bump of the buttocks which you feel when you sit on. Similarly, inflammation of this bursa is called as ischial bursitis. As you have seen, the hip joint is complex and it provides a wide range of stability. It provides a wide range of mobility and functions in our daily activities. Many powerful muscles connect to and cross the hip joint, making it possible for us to propel quickly in activities like running or jumping. The shoulder is an elegant piece of machinery. It has the greatest range of motion as compared to any joint in our body. However, this wide range of motion comes with a lot of risks and injuries. Understanding the shoulder anatomy will help you to understand how the shoulder works, how it can be injured, and how challenging it can be to recover from shoulder injury. The bones of the upper limb are the humerus or the upper arm bone, the scapula or the shoulder blade, and the clavicle or the collarbone. The roof of the shoulders is formed by a part of scapula called as acromion. There are actually 4 joints that make up the shoulder joint. The main shoulder joint, called the glenohumeral joint, is formed by the ball of the humerus and the shallow socket of the scapula. This shallow socket is called as the glenoid. The acromioclavicular or AC joint is where the clavicle meets the acromion. The sternoclavicular or SC joint supports the connection of the arms and shoulders to the main skeleton to the front of body. A false joint is formed between the scapula and the ribcage. This joint is called as the scapulothoracic joint. Is important because it keeps the muscles around the shoulder girdle stable while shoulder is moving. Articular cartilage covers the ends of the bones of any synovial joint. This articulating cartilage is 1/4 to an inch thick in all the large weight-bearing joints. But in case of shoulders, it is a bit thin because shoulder is not a body weight-bearing joint. It is very slippery and it prevents friction between the two bones. It also absorbs shock and makes the motion between the bones easier. There are many important ligaments in the shoulder joint. Ligaments are soft tissue structures which connect bone to bone. The joint capsule is a watertight sac that surrounds the joint. In case of shoulder joint, the joint capsule is formed by a group of ligaments that connect the humerus to the scapula. These ligaments are the main source of stability for the shoulders. They hold the shoulder in place and keep it from dislocating. Ligaments also attach the clavicle to the acromion in the AC joint. 2 ligaments also connect the clavicle to the scapula at the coracoclavicular joint. A special type of ligament called as the Glenoid Labrum forms a unique structure. The labrum is attached almost completely at the edges of glenoid. If you see the cross section, the labrum is wedge-shaped. This elevated structure of labrum creates more depression around the head of humerus. This is important because the glenoid is so flat and shallow. Without labrum, the ball of the humerus would not fit tightly with the glenoid. The labrum is also where the biceps tendon attaches the glenoid. Tendons are like ligaments except that they connect muscle to bone. Muscle moves the bone by pulling on the tendons. The biceps tendon runs from the front of the shoulders to the glenoid. At the top of the glenoid, the bicep tendons becomes the part of the labrum. Dislocation can be a problem when the biceps tendon is damaged. The rotator cuff is formed by 4 tendons of deep 4 muscles. Just before these 4 tendons attach the upper end of humerus, they form a common cuff called as the rotator cuff. The rotator cuff muscles lie just outside the shoulder joint. As the name suggests, these muscles help the shoulder joint to rotate in all directions. Not only that, but it helps the shoulder joint stay stable. This is done by tightly holding the humerus against the glenoid. The deltoids form the outer layer of shoulder muscles. The deltoid is largest, strongest muscles of shoulder. The deltoid muscle helps to lift the arm once the arm is away from the side. There is a structure called as bursa which is sandwiched between the rotator cuff and the deltoid muscles. These bursas are everywhere in the body. The function of bursa is to reduce friction between the body parts. The bursa is a small watertight sac containing a lubricating fluid. As you can see, Shoulder is the most complex and mobile joint of human body. Not only lifting heavy, but to get the shoulders and hands in the right direction to lift heavy. When you realize the different position in which we use the hands every day, it becomes easy to understand how hard daily life can be without the shoulder joint. At first, elbow looks like working like a simple hinge. But elbow is a complex joint and it affects movement of forearm and wrist. Elbow joint can cause problems if it is not working correctly. Our ability to use hands makes us humans. Effective use of our hands needs a stable, painless elbow joint. The elbow is made up of humerus or the upper arm bone, the ulna, which is located to the opposite side of the thumb on the forearm, and the radius, which is located to the side of the thumb on forearm. The elbow essentially is a hinge joint. It bends and straightens like a hinge. But there is a second joint where the radius head meets the humerus. It is a complex joint as the radius has to rotate while the movement happens. And at the same time, it has to slide against the humerus during the movement. To make this movement possible, the radial head is shaped like a shallow cup at the end. The shallow cup fits against the capitellum. The capitellum is a rounded knob at the end of the humerus. The radial head is also covered by the articular cartilage. It glides against the ulna. Articular cartilage is a material that covers the ends of the bones of any joint. It is 1/4 to an inch thick in large weight-bearing joints, but it is thin in elbows as elbows don't support weight. It is white, shiny, and has a rubbery consistency. It is slippery, so it allows the bones of the joint to glide against each other. Not only this, but it absorbs shock to make the motion easier. Articular cartilage is literally present everywhere where two bones come together to form a joint. It covers the end of the humerus, the end of the radius, and the end of the ulna. There are several important ligaments in the elbow joint. Ligaments are soft tissue structures that connect bone to bone. The ligaments surround the joint and form a structure called as the joint capsule. Joint capsule is a watertight sac that surrounds the joint. It contains lubricating synovial fluid. The medial collateral ligament and lateral collateral ligament are two important ligaments of elbow. The medial collateral ligament is to the inside of the elbow and lateral collateral ligament is to the outside. These two ligaments hold the head of the ulna against the humerus. These ligaments are the main source of stability for the elbows. They can be torn if there is an injury or a dislocation of elbow. If they don't heal correctly, the elbow remains loose and unstable. Another important ligament is the annular ligament. It wraps around the radial head and holds it against the ulna. The word annular means ring-shaped. This ring holds the head of radius in place against the ulna. This ligament is torn when the radial head is dislocated. There are several important tendons around the elbow. The biceps tendon attaches the large biceps muscle on the front of the arm to the radius. It allows the elbow to bend with force. You can feel this tendon crossing the front of the elbow when you tighten the biceps muscle. The triceps tendon connects the large triceps muscle at the back of the arm with head of ulna. It allows the elbow to straighten with force, just like when you perform a push-up. Muscles of the forearm cross the elbow and attach the humerus. The lateral bump at the elbow is called as the lateral epicondyle. The muscles of forearms which straighten the wrist and the fingers start at this point. Another bump at the medial side of elbow is called as the medial epicondyle. Muscles of forearms that bend the wrist and the fingers start from this point. The lateral and the medial epicondyles are important anatomical locations because these are the common locations for tendinitis, that is tendon pain. As you can see, the elbow is more than simply a hinge. The elbow joint is designed to provide stability when we use our forearms and hands. We realize this when we list down the number of activities which are performed by elbows in our daily life. Just imagine how hard our daily life can be if the elbow joints don't function well. Out of all the structures of human anatomy, the hand is the most unique structure. Hand has to be mobile to position the fingers and thumb. It should have strength to grip objects firmly. It should also have fine coordination to perform micro tasks. Let's define some common anatomical terms relating to the hand. This will help us understand the structures of hand later. The front or palm side of the hand is called as the palmar side, and the back side is the dorsal side. The thumb side of the hand is called as the radial side of the hand, and the other half is called as the ulnar side. There are total 27 bones in the wrist and hand. The wrist contains 8 small bones called as carpals. The carpals form a joint with radius and ulna called as the wrist joint. Distally, the carpals connect to the metacarpals. There are 5 metacarpals forming the palm of the hand. One metacarpal connects to each finger and thumb. Small bones called as phalanges form each finger and thumb. The knuckle joints are formed by the phalanges and the metacarpals. These joints are called as the metacarpophalangeal joints or MCP joints. The MCP joint works as a hinge when you bend and straighten the fingers. The 3 phalanges of the fingers are separated by 2 joints called as the interphalangeal joints or IP joints. The IP joint closer to your body is called as proximal IP joint or PIP joint. And the IP joint away from your body is called as distal IP joint or DIP joint. The thumb only has one IP joint between the 2 phalanges. These IP joints also work as hinges when you bend and straighten your fingers. All the joints of hand we studied so far are covered at the end by articular cartilage. This white shiny material has a rubbery consistency. The function of articular cartilage is to absorb shock and to facilitate free motion. There is presence of articular cartilage almost everywhere where 2 bones come in contact with each other. Ligaments are tough bands of tissue that connects bones together. 2 important ligaments called as collateral ligaments are found on each side of fingers. This collateral ligament prevents abnormal sideways movement of fingers. In front of the PIP and DIP joints, the strongest structure is the volar plate. This ligament connects the proximal phalanx with the middle phalanx at the palmar surface. Not only this, but the volar plate prevents the hyperextension of the PIP joints. Finger deformities are seen when the volar plate becomes loose due to diseases. Many of the muscles that control the hand start from the elbows or forearm. Running down the forearm, they cross the wrist and hand. Some control the bending and straightening of the wrist. Others control motion of the wrist and the thumb. When your fingers and wrist are performing fine motor actions, these muscles control the fingers and wrist. The muscles that control the thumb and little finger start on the carpal bones. Bulge of the muscle present at the base of thumb is called as thenar eminence, and muscle bulge present at the base of little finger is called as hypothenar eminence. Four muscles make up the thenar eminence: the abductor pollicis brevis, flexor pollicis brevis, adductor pollicis, and opponens pollicis. Pollicis is the Latin term for thumb. Each of these muscles start at the wrist and attach at the different locations at the proximal phalanx of the thumb. Each of their names suggest what they do when they contract. The abductor pollicis brevis moves the thumb away from the midline of the hand. The flexor pollicis brevis flexes or bends the thumb. The adductor pollicis moves the thumb towards the midline of the hand. The opponent's pollicis moves the thumb into opposition. It makes the pulp of the thumb face the palm. This is the motion that allows you to touch the tip of your thumb to the tip of your little finger. The muscles of the hypothenar eminence are also roughly arranged in the same manner. The smallest muscles that originate in the wrist and hand are called as the intrinsic muscles. These intrinsic muscles hold the finger steady during fine movements of hand, wrist, and fingers. The tendons that allow each finger joint to straighten are called as extensor tendons. These are the tendons of the extensor muscles at the back of your forearms. These muscles cross the wrist joint and then convert into tendons which connect the back side of the phalanges. Once these tendons enter the fingers, they are called as extensor hoods. The extensor hood flattens out to cover the top of the finger and sends out branches to both the sides which connects the bones of a finger. The place where the extensor tendon attaches the middle phalanx is called as the central slip. When the extensor muscles contract, they pull on this slip and straighten the fingers. It is problematic when this central slip is torn or injured. The flexor tendons help the fingers of the hand to bend to grip or grab an object into the hand. Flexor muscles start in the forearms, and before they enter the wrist, they get converted into flexor tendons. The flexor tendons travel through the carpal tunnel through the palm, and two tendons travel to the sides of the finger. These two tendons, flexor superficialis and flexor profundus, travel through a specialized tunnel formed through a series of specialized ligaments. The flexor superficialis connects to the base of the middle phalanx. The flexor profundus tendon connects to the base of distal phalanx. The thumb is a bit different because it has only two phalanges. Flexor pollicis longus begins in the forearm. Its tendon connects to the distal phalanx of the thumb. The flexor pollicis brevis muscle begins in the wrist and its tendon connects to the base of the proximal phalanx of the thumb. When our hands are free of problems, we usually take the complex anatomy for granted. The hand is formed by numerous structures, each one carrying important functions. Even minor injuries can damage the anatomy and functioning of hand, wrist, and fingers. We come to an end of Anatomy DIY course. Thank you so much for watching.